called Estler, and I have a cosmetic dental practice over west of Houston in Katy. And today I wanted to tell you about the most beautiful cosmetic restorations you can get, and those are veneers, porcelain veneers. Porcelain veneers come in two main types, the traditional type and the new press type, the most famous of which are lumineers. They're made differently, so let me describe to you how they're made, and then I'll tell you about the pros and cons of each one. First, let's go into the traditional ones. We all kind of remember back from, junior high and high school, we probably made some kind of porcelain thing in our art class. Maybe it was an ashtray, maybe it was a pitcher, but it was all the same. You took some clay, you put it in the kiln, you fired it, it came back kind of a dull white. Then you put some what looked like gray mud, which was ground up glass in a water slurry that was the glaze. And maybe you put it on and it became shiny white, or maybe you put some different colors on. But either way, when you put it on, it looked like gray mud, and then when you melted it in the kiln, it came back as just melted, beautiful, shiny glass. That's how traditional veneers is called stacking. What the ceramist does is he actually, on your gypsum model that represents your teeth, he or she paints this slurry of glass, and he puts one layer on, because teeth are different colors. They're a little lighter at the edge, they're a little darker, pick up some pink by the gum line. So he's actually putting a little color here. He'd fire it in the kiln, he gets back, he adds a little bit more. When he does that, a lot of air is incorporated in there. So those kind of traditional veneers must be about 1 millimeter thick to be strong enough for me to pick them up and put them on the teeth without just breaking in my hands. But what they do have is, the result of an artist working on them. They have certain pros and cons, and I'll get into those later. But now let's talk about the pressed veneers. These are the type, like the best known ones are lumineers. Lumineers, you would have a gypsum representation of the patient's tooth, and you'd have a negative mold. The ceramist would just put the slurry of glass on that gypsum representation and put the negative there and press it with hundreds of pounds of pressure, and then put that in the kiln, and out would come a veneer that could be 1/3 the thickness of a traditional veneer. It would have all the air squeezed out of it. Even at that thin, 1/3 of a millimeter, which is the same as a contact lens, it would be strong enough for me to pick up and put on the tooth. So now you kind of see what the difference is. But now let's talk about the pros and cons. One is not better than the other. I do both. Let's talk about traditional. The traditional veneer, as I mentioned, the artist puts different colors in there, different translucencies. The traditional veneer can more closely mimic a tooth because it has the different colors in it. Now let's move over to the lumineer. The lumineer can be thinner as a pro. Maybe you don't want much of your own tooth removed, so you can make the lumineer thinner because it doesn't have air in it. Remember, 1 millimeter doesn't sound like much. Remember, the traditional veneer is 1 millimeter thick, but placed on a tooth, it's a lot. You have to reduce the tooth 1 millimeter before I can put 1 millimeter on there. If you don't reduce the tooth 1 millimeter, then it looks too bulky. And so traditional veneers must have reduction of the tooth structure. A lumineer case does not have to be reduced because the lumineer is so thin. So which one is best for you? If you want the very best looking result, you would get traditional veneers. Hollywood stars only do traditional veneers. They need up close, they need far away, they need the translucency, the color. But if you came to me and said, I just don't want my teeth drilled on and I want my teeth whiter, then I would steer you to the lumineers. The lumineers require very little preparation, maybe no preparation of the tooth. Then we would make it, it's easier to prepare, it takes less time, and the result is one color. But for the average consumer, they won't notice that. So which one's best for you? You would come in and I would give you my recommendation based on if you wanted the ultimate look or reduced preparation of your teeth. All right, we were talking about the traditional veneers and the lumineers. This is a case of traditional veneers, and another advantage of traditional veneers is since they are thicker, they can hide darker teeth. And this patient had somewhat dark teeth, and so we were able to hide that darkness better than we could with lumineers. You can see how the patient had little fillings between the teeth. The teeth were out of line. We were able to straighten the teeth and lighten the teeth as well, and produce, place the natural color that would be by the gum line in between where lumineers would be just one color. And again, I always like to stress, lumineers are not better or worse than traditional veneers. They're just different. This patient, we had to prepare the teeth. If we had not prepared the teeth and just placed lumineers, our look wouldn't have been as good, but the patient would have, if his goal was to have less preparation done to his teeth, he would have had that, and if that was a priority, lumineers would have been better for him.